Hello, this is Dr. Kritika, Reader, Department of Oral Medicine and Radiology, SRM Dental College, Ramapuram campus. This is a short summary on the classification of salivary gland disorders and the differential diagnosis of swellings in the parotid and the submandibular region. First is the classification of salivary gland diseases. It includes developmental abnormalities, obstructive disorders, inflammatory lesions of the salivary gland, which can be viral, bacterial. Then it's allergic sialadenitis, systemic granulomatosis, reactive lesions, sialadenosis, immunologic disorders, functional disturbances, medication-induced salivary gland dysfunction, and last is the salivary gland neoplasms, which can be benign and malignant. First is the developmental abnormalities, which includes salivary gland aplasia or hypoplasia. Then it is agenesis, aberrant salivary glands, accessory gland ducts, and diverticuli. In obstructive disorders, there can be sialolithiasis and mucocele. Mucocele is also a pseudocyst. Next is the inflammatory lesions of the salivary gland, which is mainly referred to as sialadenitis. First is the viral sialadenitis, which includes mumps caused by paramyxovirus, cytomegalovirus infection, HIV infection, and hepatitis infection. Bacterial sialadenitis can either be acute or chronic. Next is allergic sialadenitis. Then systemic granulomatous diseases includes sarcoidosis, actinomycosis, and tuberculosis. Reactive lesion is necrotizing sialometaplasia. Next is sialadenosis, which includes the endocrine and metabolic causes. The other causes for sialadenosis are alcoholic cirrhosis, uncontrolled diabetes mellitus, eating disorders like anorexia and bulimia, and malnutrition. Next is the immunologic disorders, which includes the Sjogren's syndrome and Mikulic's disease. The functional disturbances include xerostomia and sialuria or thialism. Medication-induced salivary gland dysfunction includes anticholinergic drugs, antidepressant drugs, particularly tricyclic antidepressants, antihypertensive drugs, and antihistaminics. The salivary gland neoplasms can either be benign or malignant. The benign neoplasms include the pleomorphic adenoma, monomorphic adenoma, the Wharton's tumor, oncocytoma. The malignant neoplasm includes the mucoepidermoid carcinoma, adenoid cystic carcinoma, acinic cell carcinoma, squamous cell carcinoma, lymphoma, and adenocarcinoma. Next, we move on to the differential diagnosis of swellings in the parotid region. Swellings of the parotid region can be grouped as unilateral or bilateral. Unilateral swellings include bacterial sialadenitis, sialodochitis, cysts, benign neoplasms, malignant neoplasms, intraglandular lymph nodes, masseteric hypertrophy, and lesions of adjacent osseous structures. Bilateral swellings will include bacterial sialadenitis, viral sialadenitis or mumps, the Sjogren's syndrome, alcoholic hypertrophy, medication-induced hypertrophy, which could be because of iodine or heavy metals, then HIV-associated multicentric lesions, any cysts that could also be bilateral. Masseteric hypertrophy can also be bilateral. Accessory glands, salivary glands, and temporomandibular joint-related lesions. Next, we move on to the differential diagnosis of swellings in the submandibular region, which could be unilateral or bilateral. Unilateral swellings include bacterial sialadenitis, sialodokitis, fibrosis, cysts, benign neoplasms, and malignant neoplasms. Bilateral swellings in the submandibular region could be as a result of bacterial sialadenitis, Sjogren's syndrome, other lymphadenitis, branchial cleft cysts, and any submandibular space infection. Thank you.